Hello again to a new show of Dr. Health720. Together with me, I have Dr. Volker Meissner, who's a medical doctor with significant 40 years experience of medicine. He's also a teacher of acupuncture, and he's the founder of the German Academy for Energy Medicine and Bioenergetics. Hello, Dr. Volker. I'm very happy to have you with me.
Thank you for the invitation, Bogdan.
Thank you. I will discuss with you the theme actually of our conversation is about energy medicine and quantum medicine, basically a combination of energy and information field energy. The first question which I would like to ask is related to a life experience that you have which made you embrace the energy medicine and bring it in our daily practice, medical daily practice, because you started as a normal doctor.
I'm still a normal doctor,
yes.
But it has a really long course, a long route. When I first brought in energy medicine, I was an anesthetist in the University of Munich. And I worked in the urology department. So
right.
Normally you have elder people there.
Yes,
so
yes.
When they have to awake from narcosis,
yes.
Most of them got at least having nausea or even worse. And there was a young lady, a colleague who came back after 3 months education in China. And she put some needles in the ears of her patients and they wouldn't have nausea. They wouldn't vomit and say, oh, that's good. I want to have this knowledge as well.
Right.
This was back down to somewhat like 1980, 1979. So I've been a doctor for 40 years. It's very long. So, as normally it took some years to develop this decision. And then in 85, I started to learn acupuncture. And 10 years later, I was a teacher in acupuncture and TCM and all that. And this was the start of my, let's say, energy medical career.
Right.
And then other modalities came into my toolbox like NLP or EFT, Gestalt therapy, some psychological things. But this was the very start, back to 70 something.
So that direct experience impacted you and you just embraced and dig. And
this was the ignition. Of course, it took some years to develop the idea and get it into practice, but this was really kind of an ignition.
As a medical doctor practicing TCM and acupuncture, you developed a bioenergetic method to identify and eliminate the causes for chronic diseases and disorders. According to your experience, is cellular waste, which is coming from outside and also from our own waste, is the direct cause for the chronic diseases?
I wouldn't say so. The waste is at the end of a chain.
Yes.
The very dramatic things happen before there is the waste.
Right.
So it's the metabolism of some substances
yes.
which end up in waste. But
right.
the metabolism exactly is the cause for some autoimmune processes.
Right.
So we don't have to wait for the waste to have the trigger for autoimmune issues.
Right.
And I'd say the factors start with on an energetic level. So when in your energetic field or information field is something wrong, it's kind of a malinformation. Right. The trouble starts like really there. And it's more or less dependent on your kind of living, of your character, your properties, whatever, how this shows up. Does it go to a joint, like arthritis? Does it go to the pancreas, like diabetes type 1? All the things are there. So we don't have to want to wait for the waste. The waste is really the end. It's still there. Of course, it's causing problems for the body to detoxify when there's too much waste.
Yes.
But it's the latest
phase.
The latest point
yes.
to let's say to get back in your way. Then you get the solution. When there is the waste, the solution is the point where you could have had a solution is definitely past.
Can you explain in simple words how can we energetically detoxify with the energetic medicine or information medicine?
Mm-hmm. There are several ways. I'll give you two examples to have the span, how this works. For example, if you have a root canal or let's say a chronically inflamed or infected tooth, we can find in the energetic field, not in the X-ray, in the energetic field,
right.
We can find the tooth, we can find even the root, which is the cause.
Yeah, right.
Maybe there are teeth that have 3 or 4 roots, so you can really find the one root, which is the cause.
Right.
And then you have the possibility to use either, let's say, acupuncture, Ayurveda, kind of essences that correct the distortion in the energetic field.
I see.
And there are 2, maybe 3, but there are 2 major ways how this can develop. The first is that this tooth, as we say, explodes.
Right.
And then you have to go to see a dentist,
Yes.
and then he has to take out the root.
Yes.
From really the root of this disease.
Everything,
literally the root. And the other way is that you cure. Even though there's a chronic inflammation in the root, it could be cured just by essences when you correct the energetic field. So, and the other thing is that even though it's just a tooth, which is the cause, there is something above.
right.
So this tooth has a reason to be like this.
Yes.
Of course, when you have a lot of pressure, most of cases, people lose lots of their gums just by pressing
Yes.
or by grinding.
Right.
So, but there's a reason why they are grinding. So there's a lot of rage and anger and whatever they have as an emotional load. And if you help them get rid of this emotional load, there's no reason to grind, and the tooth would say, wow, I'm happy now, and then it heals, the tooth heals. So it's very mixed up. And when you always try to treat on this root cause, like the tooth, and do not switch off the program that made this tooth be disturbed, then you will not have a sustainable therapy.
So it's basically a psychological reason, or
Always. It's always, let's say 90, some higher 90%, where you say there's an emotional cause.
so which you have to identify and then eliminate, and probably fill with something else, which is like being healthy.
Yeah. We help the people identify that, and they have to work. They have to cure themselves.
For sure. We spoke about energy medicine, but we have not, let's say, shared so far what are the methods, I mean, frequency therapy or other type of therapies which are helping to identify on one hand, and secondly to cure. How does it work? How does it work for curing?
Yeah, there are many tools in this. There's a Facebook group, Energy Medicine Exchange. There are more than 4,000 therapists in this group, and I think it's about 5-6 years back when they said, okay, let's take together what is energy medicine.
Right.
So, and they ended up in 230 modalities
Wow.
that say we are energy medicine.
I see.
So it's a huge span.
Right.
Right? So
Right.
I think in my clinic I'm using maybe a handful of them. So there are 195 not used.
I see.
So,
I see.
but to allow these people to understand what a span is. One is, for example, acupuncture. Acupuncture is an energy medical modality.
Yes.
It's working with energy, not so much with information, it's more energy. When you have energetic psychology, you're more working with information.
Right.
Both works, but you have to decide which one to use with which patient.
Or a combination,
If necessary.
if necessary.
If necessary. Then when you know or not, you can combine these methods. So let's say acupuncture plus homeopathy is theoretically a very good combination.
Mm-hmm.
And if you know both, you will combine the right things.
Yes.
So if you are not very knowledgeable in this case, you put some needles in the body and you give a homeopathic remedy, well intended, but they end up in chaos.
Right.
Because they act against each other. They just disturb the energetic channels that the other modality would use.
Right.
So
Right.
there are really perfect combinations, but there are really bad ones.
So you need to properly understand the modalities in order to not to cancel themselves.
Absolutely. In medicine, also, you can say well done is the opposite of well intended.
Right.
Yeah.